Hello and welcome. In this session, you are watching a live cranial osteopathy treatment. It's a gentle, hands on therapy aimed at healing the body, return to its balance through the primary respiratory mechanism. So, cranial osteopathy doesn't force, it listens, it feels, and through stillness, it invites the nervous system and connective tissues to unwind from patterns it's no longer needed to hold. As I begin, I first tune into the cranial rhythm. This is the subtle fluctuation of the cranial bones, cerebrospinal fluid, and membranes, often described as the tide. It is not a metaphor, it's a palpable, it's a palpatory technique, and this tide moves through the body like a slow vision wave, and when we engage with it, we are engaging the body's deeper organizing principle. So before touching the technique, we wait, we become still, so the system reveals where it's held and where it's ready to let go. It can take a couple of seconds, might be a couple of minutes. We have to synchronize with the rhythm. So don't be in a hurry. It takes time. Now what I'm going to do, I'm going to release the occiput and basilar release. I begin by connecting to the occiput. The base of the skull hold immense importance. It is where the spinal cord transition to the brainstem and where the cranial rhythm often gets congested. So we release the occiput not by stretching, but by waiting and listening for the occiput bone to float into its natural motion again. So right where the occiput meets the sphenoid lies a deeper joint called Sphenobasilar Synchondrosis or SBS. So this is the keystone of cranial movement. Releasing this area helps to re-coordinate the entire cranial mechanism. It's where midline bones communicate, where trauma can imprint, and where rhythm is often lost. It looks simple from the outside, but deeper there is some intelligent communication is going on. We have to feel the softening of the tissues. Initially, we have to wait and relax because whenever we're going to do some kind of movement, sometimes body can resist. Body might feel it's a threat for them, so muscles got tight. So we have to hold for a couple of seconds so that our brain can predict that it is not going to harm, it is not going to do something which can affect our body. So to gain that trust, we have to hold for a couple of seconds and we have to wait for the body signal. When we start feeling like muscles are becoming a little bit softened, relax, you start feeling skull is coming out inside your fingertips. So that's the time you have to start feeling and start working on that. But don't forget that you don't have to push or you don't have to do a stretch. It's not a stretching technique. We have to gently relax and release and wait for the release. And it depends patient to patient also. If patient has a chronic history of stress or some kind of trauma or injury, that might make these areas very tight, very stiff. Sometimes it takes time, sometimes it's take less time. So it depends patient to patient condition also. Now I gently shift to connect the temporal bone, those paired curved bone that girdle the ear, vestibular system, and part of the cranial base. So the temporal bones are sensitive. They influence balance, hearing, vagal tone, and emotional regulation. So even subtle restriction here can affect how we orient to sound, gravity, and the nervous system's ability to rest. So one of the way we engage the temporal is through what's known as a Baker's hold. In this hold, I place my fingertips over the mastoid process, feeling the rhythm, motion of the temporal bone as they move in gently flexion and extension in harmony with the cranial rhythm. So in flexion, the temporal externally rotate, the mastoid moves slightly posterior and lateral, and in extension, they internally rotate, drawing inward and forward. So this motion is subtle but crucial. When these bones move freely, the inner ear, vagus nerve, and cranial dural tension all have a chance to recalibrate. In cases of anxiety, dizziness, tinnitus, or unresolved trauma, the temporal may feel rigid or asymmetrical, like one is stuck in flexion or extension. So Baker's hold allow us to hold, not correct until balance return on its own. So we don't push the bone. We just allow them to breathe, and often when the temporal soften, the entire autonomic tone begins to shift. So here we are just waiting and feeling the movement. We're not changing anything over here. Just try to feel and part of that movement. I'm not doing any pushing or pulling movement over here. As the session begins, we are no rush to apply a technique. We start with induction, the phase where the practitioner and the patient settle into stillness together. So it's like entering the field. So induction is not about doing, it's about arriving, dropping into the tide, the deeper rhythm of the body. So here I wait, not passively but attentively, for the system to show me where it's held and where it is ready to release. So this is where cranial works differs from conventional manual therapy. So it is not mechanical, it's a relation two systems are meeting with the hands simply listening at the interface. Sometimes this moment of induction, the shift from surface tension to deeper tide, is when the real healing begins. So this help grounded the viewer in the philosophy and intention behind you touch from the very beginning. Sometimes we ask ourselves that when you do SBS release, what are the structures got released? What are the areas got changes? What are the benefit of it? So it's an excellent question, Releasing the Sphenobasilar Synchondrosis or SBS is central to cranial osteopathy, as it directly affects the core of the cranial motion and indirectly influence many other physiological and perceptual system. So here's a clear details explanation of what happens during SBS release, including what structures are involved, what changes occurs, and what benefits the patient or patient may experience. So first is, what is the SBS or Sphenobasilar Synchondrosis? The SBS is the joint, technically a synchondrosis, where the sphenoid and occiput meet at the cranial bone. Though it's a cartilaginous joint in early life, in cranial osteopathy we treat it as a dynamic functional interface even in adults. So it's considered the primary driver of the cranial rhythm impulse, CRI, acting like a central gear in the cranial mechanism. So what gets released during the SBS? Number one, dural membrane system, reciprocal tension membrane, tension in the flex cerebri and tentorium cerebelli and flex cerebelli can often soften. This membrane attachment to the sphenoid and occiput and influence intracranial pressure and neural dynamics. Second, cranial base and midline bones. So the release importance coordination between middle bones like sphenoid, occiput, and parietal bones like paired bones like temporal, parietal, and frontal. So this often realigns strain pattern involving torsion, shear, or compression. Third, venous sinus drainage pathways, especially the straight sinus, transverse sinus, and the jugular foramen area can decompress, improve venous outflow from the brain. Fourth, cranial nerve, especially your 9, 10, 11, and 12. These nerves exist. These nerves exit the skull at the jugular foramen and hypoglossal canal near the occiput base. So SBS strain can cause irritation or compression, contributing to symptoms like digestive issues, vagal dysregulation, or neck and throat discomfort. So these are things which got released. Now, what changes in the body? So restoration of the primary respiratory mechanism, PRM. Second, improved cranial fluid flow, cerebrospinal flow, and venous blood. Third, it helps to release the neurological tension, particularly in the autonomic nervous system. Fifth, it softens the dural torque or internal rotational pattern. Sixth, better alignment of fascia and oral structure, palate, jaw, sinus, and all this. Next thing, what are the benefits of an SBS release? Number one, release, it can get relief from headache, sinus pressure, TMJ dysfunction. Second, it's improved the cranial nerve function, vagal tone, swallowing, digestion, even voice also. Third, better postural alignment through the occiput sacral connection. Third, it reduces anxiety, insomnia, and autonomic overdrives. Fourth, sensation of lightness, clarity, and internal spaciousness. Fifth, facilitation of fascial unwinding across the entire body due to the release of the central tension. While doing this kind of treatment, what we notice sometimes patients start feeling there is some release or there is some discomfort in this patient. What we saw, like while doing the treatment, she will start making fist or moving the elbow, feet also. So at the end of the session, patient is going to disclose what are the things she got feel that time. But here we are just focusing on the treatment. Whatever we feel, we have to release, or if whatever we feel like there is some restriction, we are just trying to release those understanding the parietal release in cranial osteopathy. So the parietal bone form a significant part of the cranial vault, creating the upper and lateral portion of the skull. In cranial osteopathy, working with the parietal is not merely about structural alignment, it's about facilitating a large reorganization of the membranous tension, fluid dynamics, and neurological coherences with the craniosacral system. So, when we begin the parietal release, what we are truly doing is just listening. The hands are placed not to impose movement, but to perceive it, to witness the cranial rhythmic impulse, the breath of life, a subtle tide that occurs through the membranes and fluids of the body. So, at the parietals, we often begin to feel the first expression of spaciousness. So, there is a lift, a lateral expansion, sometimes a gentle separation or a rhythmic fluctuation. So, this is not a mechanical thing. This is the body's tide making itself known. It might begin in a subtle way, like a feather brushing from inside out. Then suddenly the tissues begins to soften and the balls start to breathe in your hands. So now the next question is why the parietals matter. It matters because the parietal bones interface with multiple cranial structures, the sagittal, coronal, squamosal, and lambdoid, and they reflect the balance between anterior and posterior dynamics, between the frontal vault and the occipital base. So if there is some restriction here, does not only affect the cranial mobility, it can translate into tension headache, scalp sensitivity, eye strain, dural membrane tension, thoracic and pelvic compensation also. Because of the tentorium cerebelli anchors in the region, any distortion in parietal motion can indirectly affect the cerebellar tension, visual processing, and proprioceptive feedback. So, what changes as we listen to the parietals? As we stay with the parietal bones, we may feel like a separation or decompression along the sagittal suture, a lateral shift as the vault expands in a tight like rhythm, a shift in tissue tone, not just in the scalp but down through the thoracic spine and even into the pelvis also. So patient often describes sensation like I feel like my head is opening up, there are more space in my breathing, my chest and neck feel free. So these are not placebo effect, they are neurophysiological shift responses to the eases of the membrane and fascial strain. Now here we are doing the frontal lift. So the frontal bone forms the forehead of the roof of the orbits, but in cranial osteopathy, it's so much more than just a bone. It's a gateway to emotional clarity, autonomic balance, and sinus health. So when we engage with the frontal lift, we are not pulling or adjusting. We are inviting the frontal bone into a space where it can reorganize tension, especially that which accumulates through stress, visual strain, trauma, and emotional holding. So the frontal bone connects to the sphenoid, ethmoid, and parietals and has direct continuation with the flex cerebri. So any imbalance can impact the eye pressure or fatigue, emotional overwhelming, chronic sinus congestion, tension in the prefrontal cortex linked with decision making and worry. So, what we feel during a frontal lift? As we hold this space, the tissues may feel tense at first, like a holding pattern. Then, slowly, we sense an unfolding, uh, lifting, a sense of light coming into the head. Sometimes the patient signs or shifts. This is a nervous system like letting go. So the frontal lift helps shift someone from overthinking to presence, from head pressure to internal spaciousness. It's a powerful step in integrating the cranial vault with the emotional brain. So it's not just structural, it's symbolic. And when the frontal bone release, patients often say, I feel clear, lighter, more open. Now the sphenoid, the core of cranial motion. So in cranial osteopathy, the sphenoid is not just another bone, it's the keystone of the cranium. It's shaped like a butterfly and sitting deep in the base of the skull. It articulates with nearly every other cranial bones, the frontal, occipital, temporal, parietal, ethmoid, and more. So this central position gives the profound influences over the cranial base, the pituitary gland, optical pathways, sinuses, and autonomic nervous system. So how the sphenoid moves? The sphenoid expresses subtle but vital movements as a part of primary respiratory mechanism. So there are a couple of movements we're going to practice over here: flexion and extension, like a wave or breath; side bending and rotation, balancing the lateral cranial forces; torsion, which is like asymmetrical rotation of the greater wings; superior and inferior vertical strain, upward and downward shearing patterns. So these movements are not arbitrary. They are part of how the body maintains rhythm, symmetry, and neurological balances. So why sphenoid balance matters? When the sphenoid is restricted or strained, patient may experience headache, migraine, visual disturbances, TMJ dysfunction, hormonal imbalance, vagal tone disruption. So that is why it's very very important. So balancing the sphenoid, it doesn't just improve cranial motion; it creates space for the brain to breathe, and nerves to settle, and body to regulate. So releasing the sphenoid is like adjusting the central gears of the complex system. Everything else begins to realign. So now we're going to discuss about neurological and endocrine implications. The sella turcica, a saddle-like depression in the superior surface of the sphenoid, cradles the pituitary gland, the master gland that controls hormone function throughout the body. A distortion in the sphenoids can lead to a pituitary compression, disruption in thyroid, adrenal, reproductive, and growth hormone regulation, and autonomic imbalance, especially where the vagus nerve, glossopharyngeal, and hypoglossal pathways are interface. So its proximity to the optical chiasma can also cause visual symptoms like blurred vision, eye fatigue, or photophobia. Furthermore, though the dural attachment, the sphenoid influences flex cerebri via the anterior attachment. Another is tentorium cerebelli, posterior through the posterior sphenoid ligament. So So this dural tension translates into the whole body fascial response and influences spinal mechanics, sacral mobility, and even plantar fascial tone also. The movement of the sphenoid is tied to the motion of the cerebrospinal fluid (CSF) and the long tide. When we release restriction here, we often witnesses of improved cranial fluid dynamics, greater symmetry in the CRI (cranial rhythmic impulse), and translation from hypersympathetic arousal into parasympathetic healing states. Patient may report like a spontaneous emotional release, sometimes a shift in visual clarity, a deep yawn, tear release, or head opening up, or more subtly like I feel recentered. So what is happening is not psychological suggestion; it's a neurophysiological reset. Frontal and ethmoid bone release in cranial osteopathy. As I place my hands over the frontal and ethmoid bones, the aim is not to direct motion but to listen, to feel. So, this region is delicate, intimate, and deeply connected to the midline structures, the cranial base, and the emotional brain. The frontal bone forms the forehead and orbital roof. The ethmoid, light spongy bone tucked just beneath and connects the nasal cavity with the anterior cranial fascia between the gateway to the sinus, the olfactory system, the hypothalamus, and the frontal dura attaches especially to the flex cerebri. So in cranial osteopathy, these bones are not treated with force. Fine, ma'am.
Yeah,
How do you feel?
much better. That never used to happen earlier.
Hmm.
That's the reason that I'm so restless, because last 2, 3, this last when you do,
Hmm.
I don't know why I get a very tingling feeling in my hands.
Okay. While doing the session.
Yeah,
And anything else?
no, and especially here, this joint.
Both the elbow or only left side, ma'am?
It's both the sides rather.
Okay.
So
You feel
Which
like
never
there is
happened.
some radiating or tingling kind of
yes,
sensation?
yes.
Do you have any history of any injury or trauma on your elbow or arm?
No,
Nothing like that.
no.
Okay. Sometimes happen, ma'am. If you have some stiffness or something,
Huh.
it could have got released while doing this cranial osteopathy.
Okay.
That's the normal part.
That's
What happened to your leg? You're shaking your leg.
So it's the same thing. So as I said, like it's only on the joints,
Hmm.
nowhere else. Like here,
Hmm.
and it's like as if something is just you said right. It's like some radiation kind of a thing going on,
Hmm.
and then it's just settles down.
So it's happened all over the body or only the joints?
It's only the joints,
In
both
the elbow and
arm.
both the ankle?
Yeah.
Okay, ma'am. Done for today.
Thank you.
As we conclude the cranial osteopathy session, the patient reported an interesting response, radiating tingling sensation in both elbows and both ankles, particularly noticeable in the joints. From an osteopathic perspective, this is not unusual. In fact, it aligns with what we understand as fascial unwinding, which is a process where the body begins to release long held patterns of tension, often stored deep within the connective tissue matrix. So, the fascia is a continuous wave that envelops and links the muscle, bone, nerves, and organs. So, during cranial work, especially when releasing central structures like occiput, sphenobasilar junction, temporal, frontal, and ethmoid bones, the changes are not confined to the head, instead, they propagate through the entire fascial system. So, the elbow and the ankle being a distal pivot points in the fascial lines and common sites of joint strain, so often reflect or amplify fascial shifts originating from central adjustments. So, what the patient experiences as tingling or radiating is like the nervous system resensing these areas as restriction loosened and communication improved. In osteopathy, we don't chase the symptoms, we observe the body's response to improve balance and regulation. So, these sensations are not side effects, they are neurophysiological expression of changes, sign that the system is reorganizing itself towards greater symmetry, fluidity, and coherence. So, this is how cranial osteopathy works not by force but by creating the conditions for the body to remember and restore its natural rhythm of health. So, what you have just witnessed is more than just hands on therapy, as the body is responding to safety, rhythm, and release. Cranial osteopathy we doesn't force changes, it invites it through gentle contact and deep listening. The body begins to unwind patterns which is hold for years, sometimes felt far from where the work is being done. So the sensation the patient feel in her elbows and ankles are not random. They are sign and signals of facial and neurological reorganization. A system is like returning to balance. So healing in this approach is not always dramatic. Sometimes it is simple as the body whispers, I remember how to feel safe again. So thank you for joining us on this journey of quiet transformation.